Hey, welcome back to our Caregivers channel. I'm Martin Forts and this is Martin Cares because I do care and that's why we're here together. Today's subject matter will be a little bit different. We'll be talking about that hospital stay. That is the transition from hospital to home. But before you get there, some of the key individuals at the hospital you want to get to know and learn from. Yes, doctors are critical. We thank God for them. But there are other folks that are also part of the team that you really want to know and learn from. We're going to be talking a little bit about that today. Through my years working in a hospital, I can tell you that beyond the doctor, you really want to get to know by name the nurses, the care partners, the therapists, the caseworkers who will be involved in helping facilitate that discharge home. These folks are critical, they're loving, they're caring, and they are interested in making sure that you get the information you need in order to make that transition to home. The nurse is the captain of your care team. Doctors rely on them for updates on current conditions of your loved ones. Medications, administration, cleanliness, diet, mobility, and much more are managed by them. Now that short list doesn't include all the things that you and I really don't want to have to deal with when it comes to our loved ones sometimes. Cleaning them up, making sure that they're fed quickly and on time, making sure that they are responded to when they hit a call button for them, making sure that cleanliness is utmost, that is changing out linens and making sure that if there are blood issues involved, whether drawing blood or even needing blood to be cleaned up around them, they're taking care of all of that. It's a labor of love. Now, working along with them are the nursing assistants or care partners. They are probably in and out of the room even more than the nurse, making sure that your loved one is being cared for properly. Get to know these people by name, as they will get to know you by name. Getting to the doctors or getting to any other requests you have will be expedited as you get to know them and they you. The other members of the team that you want to get to know are the therapists. They are the physical therapists, occupational therapists, and speech therapists. Now they're there to help you and will provide that help and support for you as you transition to home. Again, don't be afraid to ask questions. Don't be afraid to tell them your concerns. They'll listen and they'll respond. Their teaching is important. Listen carefully and it will enhance greatly the ability on your part to be a great caregiver when you get home. There are many people at the hospital that are there to help you. But in my opinion, these are the key individuals you want to learn from prior to getting home. The last of these is the caseworker. This is the person that's going to facilitate the discharge order from the doctor, allowing the patient to leave the hospital. Get to know this person. They will help with issues of next step. It may be directly discharging them to home, or it could be going to an acute rehab facility for a short stay to get that person a little bit stronger. They also deal with long-term care issues as well. Equipment for the home, nursing visits, inpatient and outpatient therapy are all things that they can help you with. Insurance matters. They may not know all there is to this one, but they will help you ask the right questions and help you in asking the right questions on this matter as well. These are the folks that I believe are important to you. Again, get to know them, ask questions. They will help greatly to help with that transition of going home and making the home care experience that you're going to encounter that much better. So that's it on our hospital tips for caregivers today. I hope that will help you. Next week we'll be talking about the issue of hiring outside help to help with your in-home caregiving. I've got some ideas and some thoughts I'll share with you that should help you with that as well. Subscribe to this channel. Click the like button. Let me know your comments. I want to hear from you and want to respond. Until next Friday, I look forward to being with you again. And in the meantime, have a great week and a blessed one. Take care.